Hello, my name is Harold Minkowitz, and I'll be discussing Vocacapsaicin reduces pain and opioid consumption for 2 weeks following a single administration during total knee arthroplasty. Postoperative pain control remains an unmet medical need, especially after more painful procedures like total knee arthroplasty. Capsaicin is a highly selective TRPV1 agonist that is known to provide long-lasting analgesia, but successful use in post-surgical pain has been elusive. Vocacapsaicin, also known as CA-008, is a prodrug of capsaicin. Upon delivery into the tissue, vocacapsaicin rapidly releases capsaicin via pH and temperature-dependent reaction. Vocacapsaicin is highly water-soluble, enabling infiltration into the surgical site. We previously showed that after single administration during bunionectomy, vocacapsaicin provided over 2 weeks of analgesic relief and reduction in opioid reliance. In this study, we sought to replicate following TKA surgery, the benefit observed in bunionectomy could be replicated. The main part of the study was a 3-arm, multi-center, randomized, parallel group study comparing 2 dose levels of vocacapsaicin to blinded placebo. In one arm, vocacapsaicin was delivered at a concentration of 0.3 milligrams per ml, which equated to 36 milligrams of drug, which was the most effective concentration in the prior bunionectomy study. A higher concentration of vocacapsaicin, 0.5 milligrams per ml, which was 60 milligrams of drug, also was tested to see if efficacy could be increased. Intraoperatively, patients received full standard of care anesthesia and analgesia, which included spinal anesthesia with bupivacaine and fentanyl, femoral nerve block with ropivacaine, an IPAC infiltration with ropivacaine, periarticular soft tissue infiltration with ropivacaine, and intraoperative analgesia of intravenous acetaminophen and ketorolac. The study drug was delivered during surgery to the surgical site. 120 mL was A, infiltrated into the periarticular soft tissue, and B, instilled into cut bone surfaces, and C, an aliquot was instilled into the joint capsule at the end of the case. For post-op analgesia in the first 96 hours, patients received opioid rescue medication only. After 96 hours, we added celecoxib twice daily and acetaminophen PRN with Percocet PRN. Our primary endpoint was the pain at rest NRS AUC for 12 to 96 hours. The exploratory and secondary endpoints at both 0 to 96 hours and day 0 to 15 can be seen on the slide shown right now. The results showed that we had 193 patients enrolled at 4 sites. The patients were well matched at baseline. Let's focus on vocacapsaicin 36 milligrams. The primary endpoint, vocacapsaicin 36 milligrams at rest, the NRS AUC 12 to 96, reduced by 18%, which was highly significant with a p-value of 0.0004. The in-hospital secondary and exploratory efficacy endpoints were all highly significant, as can be seen from the poster. The rest NRS AUC for the first 96 hours was reduced 17%, and there was no early pain due to capsaicin. Pain with ambulation NRS in the first 96 hours was reduced 20%. Opioid consumption in the first 96 hours was reduced 30%. In addition, at 72 hours, 90% of the patients in the active group versus 63% in the placebo group could walk 100 meters. At a discharge, secondary and exploratory efficacy endpoints from day 0 to 15 showed that the rest NRS was reduced by 15%, pain with ambulation NRS was reduced 14%, opioid consumption was reduced 35%, And it's interesting to see that the opioid consumption was reduced by 30% in the hospital. After discharge, it increased to a 52% reduction despite the addition of multimodal analgesia, as can be seen in the flattening of the curve in opioid consumption. There also was a trend to earlier opioid discontinuation, which continued after discharge. Looking at our safety, we analyzed multiple parameters during the analysis, and there was no local or systemic safety signals. The safety profile of Vocacapsaicin was generally indistinguishable from placebo. The results of the higher dose of Vocacapsaicin, 60 milligrams, showed it wasn't as effective as the lower dose of 36 milligrams, but importantly, it showed no safety concerns. So in conclusion, Vocacapsaicin provided durable and clinically meaningful analgesia following total knee arthroplasty, including reduced pain and reduced opioid consumption. Vocacapsaicin improved indices of recovery. These findings suggest Vocacapsaicin may reduce or potentially eliminate the requirement for opioids following hospital discharge.